There are now more than 3,000 studies investigate the relationship between spirituality, religious involvement, and health. Usually, these studies suggest that the higher levels of religious involvement tend to be associated with better levels of health, physical and mental health. For example, higher levels of quality of life, of happiness, of purpose in life, and also lower levels of depression, substance use and abuse, or lower levels of suicidal behavior. However, one of the most challenging aspects of these studies is the understanding of the mechanisms that would explain how religious involvement could influence health for better or for worse. There are several hypotheses that we will discuss now. But until now, it's clear that none of these hypotheses can explain fully the impact of religious involvement of spirituality on health. One mechanism would be lifestyle and health behaviors. Usually, religions tend to foster health behaviors. For example, to avoid substance use or misuse, to avoid risky sexual behavior, and also to avoid engagement in violence, in interpersonal conflicts. Another mechanism would be social support. It's well also known that people with higher levels of religious involvement tend to have higher levels of social support and even support of higher quality. And the social support, feeling part of a community, and also feeling that you can ask for support of this community, is related with better health and with better quality of life. Another important mechanism would be the cognitive framework and the meaning provided by religious ideas and religious teachings. The cognitive framework provided by religion, for example, may provide meaning to the suffering. We know that when persons have some understanding, some meaning or reason to face, to cope with struggles, when they believe that they have the strengths to overcome the stressful situation, they can usually overcome in a better way, in a healthier way. And religious cognitive framework can very often provide this meaning and this cognitive resource to help people overcome stressful and challenging situations. Another possible mechanism would be the religious practices like prayer, meditation, and even trance in altered states of consciousness. Several studies have also found that trance, meditation, and prayer can have even physiological changes in person's body in a positive and healthy way. And finally, some other aspects that could influence in a negative way when the person, for example, quit psychological or medical treatments, when the person feels alienated from their religious community, when they feel guilty with no possibility of redemption, or, for example, when they have a passive way of coping, when they have a passive deferral to God and not involving themselves and struggling or in the cope in facing the challenging situations. So basically, these are some of the possible mechanisms by which religious involvement could influence health for better and worse. But it's necessary much more studies to help to refine our understanding of this very interesting and challenging relationship.